Hello dear friends, welcome to Shaft at Trichy, Tamil Nadu, which is organized by Dr. Nadesh. We will have a happy get together and happy learning there at Trichy. And I am Dr. Murugan. I am an STD and HIV specialist and also sexual medicine specialist. My topic in Shaft is foreskin and sexual dysfunction, but I want to make it as the role of foreskin in sexual function and dysfunction. That will be more appropriate and will be more apt and useful. The prepuce is not, the foreskin is not a vestigial organ by the nature's creation. It is highly innervated, sensitive, and it has a definite role. It is not a vestigial organ, and the rolling movement of the foreskin has a definite role for sexual play for both individual and the partner. So with all this, we have to consider as far as possible to preserve, whereas most of our professional colleagues are thinking that the circumcision is universally good. Of course, some individual may not be able to retract the prepuce foreskin completely. They will have congenital phimosis. Sometimes it may be tight. Sometimes it may be they may have adhesions. So in that conditions, we have to go for circumcision. Otherwise, the patient may have definitely sexual problems. Like they may be prone for preputial tear, urinary tract infection, preputial tear, forenal tear, and sexual dyspareunia. All these things can happen. So subsequently, the patient have even erectile dysfunction or may have pressure of performance. All these things can happen. Otherwise, if the patient has to be trained to retract the prepuce, and we have to stress the importance of the genital hygiene. If the individual is able to maintain the genital hygiene, circumcision is not a must. That's a message I want to give for everybody. But we have to train our children about the genital hygiene from the childhood onwards. So that is very important. Parent side, teacher side, sexual education side, all these things. So if you are keeping that genital hygiene, circumcision is not a must. So that's what we have to tell, because it has a protective function. It has helps for excitement, and also it keeps the glans penis sensitive, and the texture of the glans penis and the color of the glans penis, and also it has a special function as a skin reserve. With all these things, we should not insist for circumcision when there is a free movable and prepuce. So that is where we have to assess. Genital hygiene is more important than circumcision, and we have to know what are the function and dysfunction. So this is what I am going to tell, and it will be useful for you, and you will enjoy. I will enjoy your time, and thank you Shaf, thank you Nadesh for your valuable time. Thank you very much.